Oh, yes, indeed. When you look through some of those dailies and they're going back and forth as to what do we do with our local cures, how do we relate to all of those that we've heard coming through from Madagascar. But let's talk about where we are at the moment with Professor Innocent Uja, who is a former Director General for the Nigeria Institute of Medical Research. He joins us from Jos this morning. Good morning, Professor. Thank you for joining us today on the program.
Good morning, Chamberlain.
All right, so okay, there's a lot of talk now about what are we doing about getting local solution. Could be looking the way of medical research, and then research. I mean, many of all the other people who've talked about the alternative sources, I mean, they all have to be satisfied one way or the other. NIMR should have a huge role to play. What is your assessment about our quest so far to get at least some remedy, no matter how short it is, for COVID-19?
Well, thank you very much. The issue of research and remedy for COVID-19 is on the front burner, and it should be on the front burner in Nigeria. Unfortunately, the information I have is that probably NIMR, as a foremost research, health research institute in Nigeria, is probably not involved. And I believe that this is the time to up our game. I believe this is the time to involve the scientists, the experts, and that is where NIMR is very, very vital. Whatever it is, we can, NIMR and other health research institutes, and in fact, other scientists can come together, put heads together, and work out the best way for Nigeria. We have always been looking for what is coming from Europe and America. We have enormous talents in Nigeria, and we believe that Nigerian scientists can do the best they can, given the opportunity. As a DG of NIMR at the time, there was nothing allocated to research, as it were. I cried hours. It appeared that it didn't go on well. One thing that was happening that we thought probably was going to be very, very relevant was the National Council of Research and Innovation under the presidency at the time. Again, we've not heard much from that. And I think that if Nigeria is given the opportunity, we will do well. There is no two way about that. We have the experts.
Yeah, go ahead,
the problem
please.
With us, yeah, the problem with Nigeria is that we do not value health research. In fact, any form of research at all. So there is no funding for it. I was reading where the current DG was saying that they do not have sufficient funds for research, and it is true. So there's no way anything can move on without adequate funding.
But Professor Uja, let me jump in and ask you, I mean, have we ever had sufficient funds for research?
Chamberlain, fund cannot be sufficient. That's the truth. The issue is that what we have is pottery. And just like the current DG said, what we have been doing was to do research for other organizations, particularly the National Institute of Health of America. We compete for and write proposals for research grants, which we won many while I was in NIMR and is still on. But for Nigeria to allocate funds for research is a mirage.
Sorry, could you shed some light on that?
As a matter of fact,
I didn't quite get that point. You're saying we do research for other countries.
That is correct, because if you are commissioned to do research and they pay for it, the outcome is for them and not for us. So it does not give us the priority to carry out research for our own country needs. That is the issue. People cannot really, we do not expect that we'll get anything from anywhere if we do not activate our own research needs, because every country is peculiar in its own needs and wants. And I believe that what the government, this COVID-19 is teaching us is that Nigeria is nowhere in the area of research. as far as solutions concerned. Nigerians have experts. Look at somebody like Professor Tomori. Tomori is a great man. Look at Absalam Absalam Nasidi. Nasidi was the pioneer NCDC DG. We have, if you saw what happened during Ebola, it's not that it was a magic one. It just came from effective planning and organization. There was unity of command. There was coordinating mechanism from the Ministry of Health under Professor Chukwu, and there was commitment of health workers, doctors, nurses, and the like. And it worked well, and it was thought that it was easy. So when COVID-19 came, it was thought that it was going to be like Ebola. A lot of things went into Ebola. For instance, it was only last week that the steering committee that will advise on health national response was formed, and that was when Tomori was made the chairman. So, in my opinion, we do not think about research, because right now the number we have, we should have been able to characterize the disease. Who is involved? How are they involved? What are the pathologies? Which by now, the radiological findings should have been published either in any of the local journals or international journals like Lancet or New England Journal of Medicine. Because what we do is that whatever comes from Nigeria is taken very seriously. Look at even the US, the current person who is leading the this severe study is a Nigerian, Femi Taiwo. What it means is that Nigerians have the talent, Nigerians have the experts. What Nigeria doesn't have is the political will. And that is where we fail in our research. There are so many people, when you talk of phytomedicine, University of Georgia is a center of excellence for phytomedicine.
Prof.
The drug they are talking about, the plant is in Plateau. Why would we not explore what we have?
Prof, when you mentioned that Nigerian,
the albatross.
When you mentioned the Nigerian that is a part of that research into remdesivir, I mean, a lot of people will realize that he actually schooled in Nigeria before he became of much value outside the country. But, talking about NIMR, so NIMR was established in 1977, 43 years ago. Yes, the name was changed in 1993, and then we had the Ebola. I like to, because we were speaking with the current DG recently, and, he wasn't in charge then, but I know that you were at the helms during Ebola. Did we really do anything different during Ebola? Did we try to get a cure maybe, or do research into Ebola, such that now that we have something even bigger, we can confidently say, yes, we conquered the bear and the lion in Ebola, then we'll conquer this Goliath in court. Did we do anything with Ebola?
Well, let me just tell you that we are not given the opportunity. We have the capacity, but we are not given the opportunity. Even the patients that had Ebola, those who died and those who are alive, we wanted their files to characterize them. The files were not available. So documentation is very important. What we did as a co-chair of Ebola treatment research group, we did a lot with my colleague Amalia in NIPRID. We have NIPRID. If we have NIPRID and we have NIMR, why should we ever go out to anywhere? We have the people, we have the capacity. Even if the capacity is not optimal, why would we not train? Training is part of research. And I believe that there was no fund to follow up on whatever we are doing. And therefore, we do not have a story to tell in terms of scientific evidence about Ebola. I must tell you that when Nigeria went through the Ebola very successfully, I had, as a DG, I was invited to 3 different international conferences in Shanghai, in Paris, and in Finland. And the question was, how did Nigeria do it? And I told them that there were 3 C's that were responsible for Nigeria's success in Ebola. 1 was the unity of command by the commander-in-chief. 2 is a coordinating mechanism by the Honorable Minister, Professor Chukwu, who who I have a lot of respect for, even though an orthopedic surgeon, was a great man. He coordinated us very well. And then, of course, the commitment of the health workers. The health workers were very committed, and they did their best. And I must say that over 250 Nigerians were trained and sent to Liberia, Sierra Leone, and Guinea to help them contain the Ebola. They did very well. Where are they in this response? I need to know. I'm no longer the DG, so I may not have the benefit of knowing. But where are they? These are people that you activate and bring new people, then synchronize. It's science, it's not about politics. It's science. And if we had got all this, the platform, I'm sure that Nigeria would have been better. Let me just say this. Nigeria is doing fairly well. Lagos State is doing very, very well. There's no two way about that. And at the time, I actually predicted, and I said, look, this Ebola that came through Lagos, if it had come through any other state in this country, would have been finished. Now, that has been vindicated by what is happening in places like Kano, in Yobe, and other places. Lagos is very, very ready.
When you say...
To start with, what was the level of emergency preparedness and response? Let's know how much of training went before this process, how much of the scientists are involved. Even look at PTF. How many scientists are there?
I'd like to pick up on something.
It's science that drives development.
I'd like to pick up on that point. Right, I'd like to pick up on that point because earlier you mentioned, yeah, we can hear you. Earlier you mentioned that, science is not politics. But for some people, they see politics as largely determining what happens with science, the kind of policies we make at different levels, budgeting, for example. And I'd like to know, when you say that there hasn't been enough budget for NIMR and medical research in the country, a lot of people will want to understand, is it that you submitted your budget, for example, when you were in charge and it was cut? Or what exactly happened? Because we keep hearing this, but it's hard to understand how that is a major issue. What happened during your time?
Yes, let me tell you this. I agree that politics is important, but politics is not played with science. You see, the political aspect of it is Mr. President, who gave his commitment. Mr. President gave his whole commitment. He allocated money. And that is what is important. That is the political way we're talking about. Having done that, how has the money been dispensed with? That is the issue. Now, you go to the defense budget. You'll be surprised. I went one of the years, I went to defense budget and I put training, capacity development. One director of finance had the temerity of asking me, what has NIMR got to do with training? That shows the limit of his knowledge. It means that people who do not have the capacity are being put in places where they cannot perform. How can anybody carry out research without training? That was the question the director of finance asked me when we were presenting budget. So you present your budget and you are given an envelope. If you open the envelope is empty. So the truth is that the politics of it is that the political arm, they will allocate fund. How that fund will be disbursed is another kettle of fish. The only thing true is that the Nigerian government should commission research. Whether Europe, America, they commission research. When you have problems, you commission research.
Well, Prof, just quickly, before you go on, just one moment, Prof, before you go on, you just mentioned now that you open an envelope, the envelope is tempting. What's the intention of that envelope?
To you. But when you open that envelope, there's nothing there. It's to pay salaries. You pay salaries. Is it why NIMR is established just to pay salaries?
Okay, just one moment.
Not the aim.
Just one moment. Yes. Just one moment. There was a document that was developed in 2014, the National Health Research Policy and Priorities in 2014. I don't know whether it was before or after the Ebola, but then just recently, the Minister of State for Health said that despite that document being developed in 2014, health research in the country has been largely uncoordinated with lack of synergy between the various research institutions. You mentioned NIMR just a little while ago. You also mentioned NIPRID. What kind of collaboration? First of all, what do you think of the statement credited to the Minister of State for Health, Dr. Mamora? And what kind of partnership, what kind of collaboration do we have between these research institutions?
Well, you are right. There's no coordination. And there's reason for there not to be a coordination. By 1974-75, NIMR was the coordinating center for research, even giving grants, just like National Institute of Health. At the moment, National Institute of Health coordinates all grants in the United States. Where is that in Nigeria? That power, that authority by NIMR to coordinate research was removed when the act was put in place in 1977. So there's no coordination. Even me and Gamaliel wanted to work together. We even had a series of meetings. Where was the fund? Where's the coordinating mechanism? But then the federal government of Nigeria, I think before 2015, had what we call National Council for Research and Innovation. He said they were establishing it and that to coordinate all research. We have not seen that. I've not seen that yet, unfortunately. So what I'm saying is that research is not given any priority in Nigeria. Whether it is health research, whether it's engineering, whether it's agriculture, research is not given. And that's why we run round and round and round. We cannot make progress.
Forgive me, but there's something you just said now that I think we need to, I might give vent to the fact that research isn't getting the kind of regard it ought to get. If health research or medical research institutions in Nigeria are not coordinated, then why would anyone give attention to an uncoordinated system? Health care, service delivery or service practitioners are supposed to be united whenever there is an issue. They are even supposed to look forward, so to speak, project, the projection that things are going in the world. So if there is no coordination, who should be held responsible?
Now, we are policy implementers. We are policy implementers. We are not policy makers. The coordination should be in the Ministry of Health. It is not NIMR that will, unless NIMR is given the authority and power, which it had in around 1973 to 74 and 75. If that power is removed, who is going to coordinate? And the coordination mechanism or office should be the Federal Ministry of Health. Unfortunately, there is no such a thing. And like I said, the National Council for Research and Innovation, where is it resident? It's resident in the presidency, we are told. And if that is the case, now what has it done so far in the last 3, 4, 5 years, even before the last government? So the reality is that there is no coordinating mechanism. We all work, and but we individually, I must tell you, while I was DG, I coordinated with a lot of people. I coordinated with teaching hospitals. I coordinated with universities. There was some research on sudden deaths that I coordinated, that we started in NIMR, and over 12 teaching hospitals were involved. Now, that was my initiative. And I must say, too, that when I was in NIMR, we established one of the research teams that we established was Emergency Preparedness and Response Research Team. And that was supposed to predict the likely epidemics that may arise, issues of Lassa, issues of cholera, and we worked very well in that regard. However, like we talked about the national coordination, there is no national coordination, and we need it because the United States of America has National Institute of Health, the United Kingdom has Medical Research Council, so why would we not have that? NIMR had that in the 1970s. What has gone wrong? That NIMR was stripped of that power and authority. That is
okay, well, I know
like
that,
I said, until we realize that.
All right, Professor. Let me ask you this. Sometime in March, the current Minister of State for Health did announce that the NIMR had determined the genetic sequencing that was causing COVID-19. He said that was a huge feat, being the first to have done that in Africa. Where do you see that headed?
Well, again, that's why we are saying that Nigerians have experts. All they need is stimulation. And how do you stimulate? You provide funds and provide an enabling environment. We had to actually use our initiative to work. Otherwise, we'll just be sitting and be receiving salaries only. I remember that as DG of NIMR, we had to do what we call, we had an understanding with a company that gave us about 4,800 so that we can study papilloma virus, the virus that causes cancer of the cervix. We didn't have to pay anything, but we were buying the kits. And as soon as we got to that level of the cost of that cobalt 4,800, that equipment became NIMR, NIMR's own. And we had to use our initiative, we have to use our creativity to work in an environment where
Prof, if you can hear us, just before we round off this conversation, I'd like you to end on this note. So there's been the order for Madagascar's cure. There's a talk about looking inwards also. A lot of herbal companies have come out to say, well, we can do this thing, we just need some support. How long does it take to validate a drug? Because I understand that the Ministry of Health, or generally the PTF, says that that drug, the cure, will be subjected to, internal validation. How long does that take?
Well, I'm sorry, I don't know. I'm not a pharmacologist. I'm not a pharmacologist. I'm not a pharmacist. That is the work of NIPRID. And when NIPRID finishes its job, they bring it to NIMR. Study. Because the drugs are supposed to be studied by the pharmacists and pharmacognosist and pharmacologists. And after that, it goes to clinical trial. And that is where NIMR comes in very closely. But even then, we could be working together. But that is resident with NIPRID. And I believe that NIPRID has the capacity to do that. Unfortunately, we do not like what we have. Nigeria has all the plants that are needed. All we need to do is to harness them. But to harness them, we need funds because there is commitment. We have scientists. Like I said, in the US, it's not a Nigerian that is leading the team for the drug for the treatment of COVID-19. So we have them in abundance. Again, because you can see what is happening in Nigeria, the issue of brain drain. When you are not satisfied with what is available, you move to where you are valued. You move to where you can make impression. You can contribute to national development or to
Professor Oja,
development.
We'll have to anchor at that point.
Nigeria should be given a chance.
Thank you very much indeed, Professor Innocent Oja, former Director General, Nigeria Institute of Medical Research. Okay.